Hi, Dr. Bodhisattya. How are you? Congratulations.
Thank you very much, sir. Thank you so much, sir. Sir, feeling very good.
Yes. It's a wonderful rank that you have got. 10th rank in common merit list, and you have
Yes, sir.
performed really wonderful in the interview round, and you have got 4th rank in AIIMS merit list. That's
Yes,
just
sir.
too
Yes.
good. So that's a short rank in AIIMS Delhi, which you wanted to opt for. So
Yes, sir.
that's nothing more than this. It's really good. We are really proud our students performing really well this time, and happy to know that it's a proud privilege for us to take an interview with you. Now, shoot, Dr. Bodhisattva, about yourself. Where did you do
Yes, sir.
your studies, and how did you reach till this level?
Yes, sir. Sir, basically, I am, sir, born and brought up in Kolkata, sir. I did my MBBS from Medical College, Kolkata. And in 2018, I joined the MD Medicine program in Safdarjung Hospital, New Delhi. So last year in 2021, in August, I completed my tenure in MD Medicine. And at the end of third year, actually, I had started my preparations for DM gastroenterology. Actually, my basic interest was towards a subject which had a little surgical point of view, basically hands-on. So in that, gastroenterology was the top in the list. So that used to fascinate me a lot. So from there, I gradually developed the interest and then started preparation from there on, basically.
Oh, great. Nice to see a physician who has interest on surgeries and wants some hand skill. So you opted gastroenterology to be the subject of your choice based on your pre-test probability of your different interests. That's
Yes,
good.
sir. Yes,
So
sir. Yes,
nice.
sir.
I'm happy that you got what you really wanted. You just said that you started your preparation in final year of MD. Now,
Yes, sir.
that's surprising, but because during your MD time to still be sure that this is the subject you want is something great that would give you a lot of advantage with respect to the time
Yes.
lead time for preparation. So that's excellent. So how so early, no, in MD days only, how did you decide? Just that it had some skills, hands-on skills, which
Actually, sir.
interested you?
Yes, sir. Actually, sir, from my internship days only, I was very keen in surgery. Matlab, surgical postings, I was very keen in that. So basically, then I joined medicine program in, but I had in that in the back of my mind, ki I wanted to do something which has a little surgical aspect to it. So in that, actually, cardio and gastro were the main branches which have mostly surgical aspect to it, combined with medicine. So that was the thing. And another thing, sir, in our institute, many professors and faculty members are very interested in gastroenterology. So I used to attend the gastro medicine OPDs also. So those section of the patients used to fascinate me also, especially the hepatitis B and treatment, hepatitis C, all the regimens and what follow up. And basically gastro as a subject is mostly your guideline based. So I felt ki if once you're conversant with the guidelines, basically it is universal. So those are the aspects which fascinated me mostly. So
Good.
from then I used to take interest in gastro, sir, basically.
Great, yeah. So it's nice. It's nice to see that you had a dream and you got it now, and you are sitting top on the your dreams, and it has come true. We are all happy for that. So now,
Thank
just
you, sir.
two to three important facts on how was your preparation strategy to get up to this level. Like, what did you do different, or is it a routine studies? How did you study? What books did you study? How did you
Yes, sir.
separate out your time and different aspects of your preparation strategy for the theory exam?
Yes, sir. So basically, first and foremost, my Harrison was most important. So I had covered up with my Harrison by the end of second year itself. I had given mostly the important topics. It's not possible to read the entire thing, but mostly I had read the important topics by the end of second year. So at the beginning of third year, I had started my revision. So I was specifically focusing on the gastro section over there, and simultaneously I started preparation for the gastroenterology for the INI exams basically, and for the NEET SS also. For that mainly I focused on Slensinger. So Slensinger I usually used to go through the charts, mainly the charts which are important, the guidelines, the diagrams. Those were the things which I covered up mostly, because it is not possible to read the entire book. So basically I took help of few of my seniors also. They also guided me ki what are the important topics, how to cover them up. So I followed that path. Basically I went through most of the main topics, and basically I went through them, the charts and the protocols which were given. Mostly I went through them, and in between I used to solve MCQs through different platforms, and I even went through the Stensinger review book also. So that was very helpful in the preparation portion, because this year in NEET SS also many questions were directly copy pasted from the review book itself. So that helped me a lot. And few common topics which were important, basically I felt ki the hepatitis section is very important. Hepatitis B, C, what is the management and all. Then your eosinophilic esophagitis, which is very commonly asked in AIIMS, repeatedly it has been asked. Hepatocellular carcinoma, these were very important. Ulcerative colitis, Crohn's disease. So these topics I were thorough through Sensinger. Mainly I read these topics from Sensinger itself, basically.
Sure, good. So because of seniors plus the platforms that you were on, you got an idea on what are the important topics, and you were able to concentrate on predominantly them. And one more important thing you told was going through pictures and flowcharts of Schlesinger, so that you would be able to converse it easily when they ask about management also. So and Schlesinger review questions helped a lot with respect to the approach-based questions that is recently trending. Excellent. So put in a nutshell, you have told the entire thing on how to prepare for MCQs, and that really helped you. That's important. Okay, you got a rank, excellent, 10th rank. Now, how did you jump from 10th rank to 4th rank? That's the trick in interviews.
So actually, the credit for that goes to you too, sir. Sir, actually, I came to know through DocTutorials you were conducting one interview session for the before the practical exam, and so I still remember it was late in the night, till 11:30 in the night. We were having conversation, and it was really very fruitful. I got a idea of the real interview, how it would be, and what are the important things which we tend to make mistakes, basically. So I got the idea what are the things which should speak, what things which should avoid, what are the things, common mistakes, and the important topics that is the most important, because practical aspect, basically we have not that much exposure in the practical portion. Basically in my institute also there is no separate gastro department, so the practical approach which you told was very helpful. So I could because some of the questions this time were asked from the your image based questions were also there, spotters were also there. So whichever you had shown, many of them, from the combination of that I could just guess what they were telling. So I got a brief idea about how to go about in the interview session, and that helped me a lot.
Okay, great. So we are happy. So ultimately, when you get a rank and then improvise on that in your interview, and I remember distinctly that because of other commitments and patients and emergencies, we could not schedule it little early. So all of you were there in late night, all 8 of them actively.
Yes, sir. And sir, you told that day also ki whoever interview I have taken previously, they get in the good institute. So that day I still have a screenshot of your last EA. For the motivation I kept it as a picture, and I saved it in my mobile also. Ki later on, the day before the exam I saw it, and that gave me a lot of moral confidence boost also I got after seeing that. Ki
it's a trend we have set it. See, we recently started it in DocTutorials platform, where first year itself we got good results, and then this is the second time that it's followed. So we are happy that we also want to develop on our students' requirement, because each student, the requirement is different. Some students want from Harrison Bay, some students want Schlesinger, some students want. So when we combine all the students in one platform and start taking cases for them, you will know what is the strength of each student. That is, you know that most of them are in the same boat. Most of them make mistakes in similar pattern. So the questions are in similar grounds where it's slightly tougher, like statistics, sometimes COVID-based questions, sometimes picture-based questions, sometimes case approach-based. So it's all about, we have all gone through the student phase where they know that this is the place where we may go a little wrong, or
Yes,
stay
sir.
not tell, though we know the answer, we might not talk the answer out. So they're important topics. So that is what made us specifically do the interview mock session, so that most of our students get help. And the best part is, most of the students who come for that interview round, majority get a good seat, if not in that immediate exam,
Yes,
the
sir.
next
Yes, sir.
NEET itself, all of them are in like top institutes. So that
Yes,
was
sir.
something
Yes.
I had to tell and share with, because all of them, it's so busy now. If I want to talk to them also, I have to see, "Arey, aap log free hai kya? Aapse baat karo, what are the questions you got," and things like that. So now I'm happy that in AIIMS Delhi itself, we have first year, second years, and third years, and in all the years we have our students there, and we're able to get inputs from them. So they are doing really well. So happy to know all this. So you are always welcome. Welcome to the club, first of all, and keep in touch. Your inputs have been
Definitely.
really helpful and will be helpful for the next generation of
Yes,
students
sir.
and
Yes,
your
sir.
colleagues who are applying for the exams. So
Definitely.
we shall ourselves meet in the various conferences of the department. Sure, we'll keep in touch with you.
Definitely, sir.
And
Definitely, sir.
even in the questions formation and any doubts, you can contact us. We are also there for you always. Even with respect to patient based scenarios, you can always contribute in terms of questions. And we may also have further interviews where we can specifically gather students to specifically pinpoint and ask the trendy questions which are coming up, how to solve case based questions, because this is a scenario which most of the students face. Like at this point
Mm-hmm.
of time, most of them during their MD time, they are facing so many subjects, and suddenly when they have to prepare for a different NEET based and then for a different
Mm-hmm.
NESS,
Yes.
so they are confused. So these, you guys are achievers who you have prepared for both and have been able to achieve, and have been able to achieve at different rounds, not just MCQs. You have gone around interview rounds and you have been able to impress the examiners, is something great. And when you say that our interview round really helped you, there's
Yes, sir.
nothing more that we can say, right?
Yes, sir.
So
Yes,
good.
sir.
I guess that in 2 days you will be getting the good news of getting the seat there and going to AIIMS Delhi. So
Yes, sir.
a very proud moment for all of us. So
Thank you, sir.
I'm
Thank you,
happy
sir.
to share the excitement with you. Any
Yes.
specific advice, like how to stay calm? Because most of the students know they get tense. I saw you that in the interview round also, you were able to maintain your composure and tell your answers slowly in a
Yes,
calm
sir.
way. Something I just pointed out that day itself and told that you have good chances. So how did you, like, what is your suggestion for students when they answer in the interview round, like to stay calm and answer? Did you do some magic, or was it like clear
No,
your
sir. No.
mind and
Sir,
you go
it's
about it?
nothing like a magic, sir. Basically, the questions which they ask are very clinical based. So basically,
Okay.
if we have attended the rounds and all, we will have a basic idea. So a basic understanding is very important. And the important thing is they don't test your knowledge in depth, because it is not possible for us as medicine residents to know in depth about gastroenterology practices. That is something which they are going to teach us over the next 3 years. So they are mainly they see your approach. So basically, it is not that just a patient who comes with abdominal distension, you are thinking about cirrhosis. That is not the only thing. So basically, you should think of a cardiac cause or maybe a renal cause. So this is the approach which they look. So I felt that approach is very important. So this is what stands apart in the interview. This is makes difference of 2-3 marks there only, because the approach portion is most important according to me, which I felt in the interview, giving the interview. That was the most important part. And whatever we are telling, we should be confident in what you are telling. So that is very important. Confidence is the key basically. So you should take time, and you can think, and you should say, but tell something which is relevant. Just don't tell for the sake of telling. If you don't know something, it's better you just keep quiet rather than telling something which is out of track. That creates a negative impression basically. So I felt that.
Exactly. So be confident in what you know and be sure. Tell it slowly, it is fine. If you don't know, tell you don't know. They will
Yes,
at
sir.
least go
Yes,
to the
sir.
next question. It is
Yes,
like
sir. Yes,
simple, practical viva. They're not
yes, sir.
testing
Definitely.
in depth. They're just testing your approach so that you can
Yes,
stay
sir.
calm. And luckily for us, we discussed the clinical scenario and the
Yes, sir.
spotters
Yes, sir.
and
Yes, sir.
some image-based questions, and somehow case-based. It all helped and came in hand that time.
Yes, sir.
So
Yes, sir.
Good, good. We are happy. So keep in touch, Dr. Bodhisattva. We are really, really proud of you, and
Thank you
convey
so
our
much, sir.
regards to your parents and all your friends. And
Thank you, sir. Thank you so much for your blessings, sir. Thank you very much, sir.
absolutely,
Thank you
we
very
are
much.
proud of you. Thank you. Thanks
Thank
a
you,
lot.
sir. Thank you so much, sir. Thank you.